Just 2 weeks of drinking sugary drinks increases risk of heart disease. By Dr. Joseph Mercola. If you're looking to make a significant healthy improvement to your diet, cutting out sugary drinks would be one of my top recommendations. Such beverages provide little in the way of nutrition, making them a top source of empty calories. But this is only the tip of the iceberg for why you should consider eliminating them from your diet. Research continues to show a strong correlation between sugar-sweetened beverages, obesity, and chronic disease. What's more, it only takes a couple of weeks for these drinks to start wreaking havoc on your health. Consuming beverages sweetened with high fructose corn syrup increased risk factors for heart disease within 2 weeks. The health effects worsened as the dose of high fructose corn syrup increased. Past research has also found a significant relationship between added sugar consumption and increased risk for heart disease mortality. A new study published in the Journal of Clinical Nutrition found that consuming beverages sweetened with low, medium, or high amounts of high fructose corn syrup increased risk factors for heart disease within 2 weeks. The study participants, who were otherwise young and healthy, consumed high fructose corn syrup sweetened beverages that accounted for 0%, 10%, 17.5%, or 25% of their total daily calorie requirements. Hourly blood draws were used to monitor changes in lipoproteins, triglycerides, and uric acids, which can indicate heart disease risk. All of the risk factors increased within 2 weeks among the participants consuming high fructose corn syrup sweetened beverages, and the effects worsened as the dose of HFCS increased. The study's lead author told Science World Report, "These findings clearly indicate that humans are acutely sensitive to the harmful effects of excess dietary sugar over a broad range of consumption levels. Excess added sugar is repeatedly linked to chronic disease. Added sugars and processed fructose in particular is a primary driver of metabolic dysfunction. Refined fructose is actually broken down very much like alcohol, damaging your liver and causing mitochondrial and metabolic dysfunction in the same way as ethanol and other toxins. It also causes more severe metabolic dysfunction because it's more readily metabolized into fat than any other sugar." A recent meta-review published in the Mayo Clinic proceedings found that once you reach 18% of your daily calories from added sugar, there's a twofold increase in metabolic harm that promotes prediabetes and diabetes. A study published in the Journal of American Medical Association also concluded most U.S. adults consume more added sugar than is recommended for a healthy diet, and there's a significant relationship between added sugar consumption and increased risk for cardiovascular disease mortality. The 15-year-long study, which included data for 31,000 Americans, found that those who consumed 25% or more of their daily calories as sugar were more than twice as likely to die from heart disease as those who got less than 10% of their calories from sugar. On the whole, the odds of dying from heart disease rose in tandem with the percentage of added sugar in the diet, regardless of the age, sex, physical activity level, and body mass index. A 2014 study came to the very similar results. Here, those who consumed the most sugar, about 25% of their daily calories, were twice as likely to die from heart disease as those who limited their sugar intake to 7% of their total calories.